AMA urges HHS to preserve USPSTF membership amid overhaul concerns. The American Medical Association, AMA, is sounding the alarm over potential changes to the U.S. Preventive Services Task Force, USPSTF, urging Health and Human Services Secretary Robert F. Kennedy to reconsider plans that could lead to the complete overhaul of this vital organization. This move, they argue, could significantly disrupt the development of national clinical guidelines that are crucial for patient care. In a letter dated July 27, the AMA expressed its deep concern regarding reports suggesting that all current members of the USPSTF might be replaced. The organization emphasized that such a drastic measure could jeopardize the task force's essential role in crafting evidence-based recommendations for preventive services, which include critical areas like cancer screenings and mental health assessments. The AMA highlighted the importance of the USPSTF, stating, "The USPSTF plays a critical, nonpartisan role in guiding physicians' efforts to prevent disease and improve the health of patients by helping to ensure access to evidence-based clinical preventive services." They strongly urged Secretary Kennedy to maintain the existing members of the USPSTF and to uphold the established practice of regular meetings that facilitate ongoing collaboration and updates. In addition to advocating for the task force, the AMA also pointed out the importance of ensuring that biomedical devices are always ready for use in patient care. They referenced GE Healthcare's ReadyC technology, which addresses common frustrations such as lack of network visibility, manual troubleshooting, and device downtime, ensuring that care teams are prepared to provide the best possible service to patients. Members of the USPSTF are selected through a public nomination process and consist of highly regarded experts in fields such as primary care, prevention, and evidence-based medicine. These volunteers are responsible for reviewing scientific evidence to offer guidance on various preventive measures, including screenings, counseling, and medications that are essential in primary care settings. The recommendations made by the USPSTF hold considerable influence. Under federal law, health insurers are mandated to cover services endorsed by the task force without requiring any cost-sharing from patients. This includes vital screenings for colorectal, breast, and lung cancer, as well as evaluations for anxiety and depression in children, and strategies for preventing cardiovascular disease. The AMA also noted that the work of the USPSTF aligns with the broader initiative known as Make America Healthy Again. They cautioned that any disruption to the task force could lead to delays in updating clinical recommendations, which could ultimately have negative repercussions for patient care and public health outcomes. As of now, there has been no official statement from the Department of Health and Human Services regarding this matter, and the agency has yet to respond publicly to the AMA's concerns. But here's where it gets controversial. What if the overhaul of the USPSTF leads to a shift in the quality of preventive care? Could this change impact the health outcomes of millions? We invite you to share your thoughts in the comments below. Do you agree with the AMA's stance, or do you see potential benefits in a new direction for the USPSTF? Why RFK Jr. plan to overhaul cancer screening panels could be disastrous. Imagine a world where catching cancer early becomes a political battleground. Now, that's precisely what's happening as RFK Jr. reportedly considers dismantling one of the most crucial groups in preventive healthcare, the U.S. Preventive Services Task Force. As a practicing physician, I can't sit idly by while such an essential institution is put at risk for reasons that seem more ideological than scientific. Let me explain why this matters so deeply and how it could affect every single one of us. A few months ago, I met a patient whose life was saved because of the very system RFK Jr. now criticizes. During a routine checkup, her doctor followed the task force's guidelines and ordered a scan since she had a history of smoking. That decision revealed a 6-centimeter mass, a sign of lung cancer. Thanks to this early detection, my patient began chemotherapy and immunotherapy treatments, giving her hope for a longer, healthier life. Early detection isn't just a medical term. It's often the difference between life and death. Without the task force's recommendations, her cancer might have gone unnoticed until it reached stage 4, when treatment options are far more limited. And here's the part most people miss. This kind of scenario happens all the time, quietly saving lives across the country. For over 4 decades, the U.S. Preventive Services Task Force has been crafting evidence-based guidelines to help doctors identify diseases before they become deadly. These aren't random suggestions. They're rooted in rigorous research and updated regularly to reflect the latest advancements in medicine. Primary care physicians depend on these guidelines to prioritize which tests will benefit their patients most. Insurance companies also use them to determine coverage policies, ensuring that critical screenings remain accessible to millions. But here's where it gets controversial. Reports suggest RFK Jr., serving as Health and Human Services Secretary, may replace all 16 members of this expert panel. Why? Allegedly because he believes the group has become too woke. Yes, you read that right. Preventing curable diseases is apparently now considered too progressive for some circles. Let's unpack what woke even means in this context. Is recommending cervical cancer screenings or encouraging mental health checks for new parents really radical? Some critics point to language choices, like using persons instead of women. But does semantics outweigh saving lives? Surely, we can agree that nitpicking terminology shouldn't stand in the way of public health progress. This isn't the first time RFK Jr. has targeted vital health panels. Earlier this year, he fired all 17 members of the CDC's Advisory Committee on Immunization Practices, replacing them with individuals known for questioning vaccines. This move coincided with a spike in measles cases, the highest in 30 years. Coincidence? Maybe not. When trust in science erodes, public health suffers. If RFK Jr. follows through with his reported plans for the Preventive Services Task Force, we'll face a double blow. At a time when Medicaid cuts have already reduced access to care for vulnerable populations, undermining preventive services would cripple another cornerstone of public health. Taking these steps won't make America healthier. It risks dragging us backward in the fight against cancer, heart disease, and countless other conditions. And this is where your voice comes in. Should politics dictate who gets screened for cancer or depression? Do we want to live in a society where ideology trumps science? These are tough questions, and I'd love to hear your thoughts in the comments below. Because if we don't speak up now, the consequences could be dire, not just for individual patients, but for the entire nation's well-being. Dr. Thomas K. Liu is an assistant clinical professor of medicine at Stanford University School of Medicine and an attending physician at Stanford Healthcare Tri-Valley. The opinions expressed here are his own. You can follow him on X @ThomasLiuMD.